Hello. As I was preparing my comments for today, I thought about what the conference was supposed to achieve, the objectives. I was thinking about the cutting-edge issues that we might want to talk to you about, and of course the work of the researchers who talked before us today. All in an effort to gauge what you might want to hear about our family's experience with the BRCA1 mutation. Am I too close to this? Are you guys I'm okay? Turn it down? Okay. But after several hours of starting and stopping to prepare my comments, getting another cup of coffee, folding a load of laundry, checking my email again, and whatever else might help postpone the work at hand, I decided that I would proceed on the basis not of what you might want to hear, but of what we want you to hear. Today, Katie and I are going to talk to you about the lived experience of having the BRCA1 mutation. This is our first slide, and we'd like to use this slide to set the stage. To begin, BRCA1 has a long history in our lives. The woman you see on the left side of the screen is my grandmother. It's Katie's great-grandmother. She had 5 children, and 3 of them were born with BRCA1. This woman died of ovarian cancer at the age of 41, and she left behind 5 little orphans, and one of them was my mother, who was 4 years old. In the middle, you see a picture of my mother and her sister, her younger sister, Carmi. And this picture was taken approximately 1 year after the death of their mother. This is the only photograph that remains of my mother as a child. And in the picture, you can sense what these little girls might have been feeling. Neither one of them is smiling. They are wearing torn dresses. They're barefoot. They're disheveled. They're dirty. They look orphaned, and there is a certain lostness about them that they would never fully recover from. Below is a picture of my mother, and this was a picture that was taken when she was graduating from nursing school, and she was diagnosed with breast cancer at 35. At that time, I was 6 years old, and I remember her as a blur of love and woundedness, wearing a pink robe. Her sister Carmi, in the picture in the middle, also had breast cancer at 32. She had a second primary at 53, and she had colon cancer in her 60s. She had 2 daughters. One of them developed breast cancer and is living. The other one developed ovarian cancer, died in 2006, and left a little 6-year-old boy. So she basically repeated the legacy that her grandmother had had. And the third of the siblings to have BRCA1 was my Uncle Anthony. He died of pancreatic cancer. His children, some of whom were BRCA1 positive, had lymphoma. There are parotid cancers in that family. And this is a little bit of a shift away from the BRCA1 topic, but I think it makes a good point about how confusing this all is. His daughter developed IPMN, which is a intraductal papillary mucinous neoplasms, which are widely regarded as precursors to pancreatic cancer. And she is a person who had a prophylactic pancreatectomy in February. I bring this up, and I'd like to add that her 2 twin daughters, who are in their late 20s, also have Glanzmann's thrombasthenia. And it's interesting to me because Glanzmann's the mutation for that is located just down the road from where our BRCA1 mutation is. Both of these young ladies have BRCA1, and they have Glanzmann's. I think it's interesting because it lets you know that we as patients understand a lot, but there's a lot that we don't understand, and we know that you don't understand it either. So we're an object lesson in how confusing this is. So you see the facts of the matter present a complicated web of illness and chemo and surgeries and radiation. And you might say, echoing Dr. Faust from yesterday, that the universe has broken the law of battery in our family because unconsented assault has occurred in every generation. And the bottom line for us is that information is better than no information. But perhaps more germane to our work here today is the story of our ontological journey, that is, our search for what this mutation has had to tell us about ourselves. Who are we, mentally, spiritually, physically? Are we making the correct inferences about our health, about our futures? How do we cope with this confusion? Who is here with us to move us toward the inferences and assumptions that will be healthful for us, and to gently disabuse us of the ones that will move us away? These questions are at the heart of our presentation, and the heart of our presentation brings us squarely into the domain of bioethics, where lived experience meets research data and philosophical inquiry to bring about a more fulsome discussion where each of our perspectives will count. With that, we're going to turn now to a 3-minute video. And I would just like to say before we look at this video that my husband Sam is here today, and he had the presence of mind to tape this on the very absolute worst day of my life. The reason we're showing it is that you'll see some very interesting behaviors in these little ones as they try to make sense of what they're experiencing. Their experience informs their expectation. So I think with that, we'll start showing it. Is that okay? Okay.
Oh, that was loud.
We saw you in that window a minute ago. We're just sitting here waiting for you.
Why can't we go in our room? You can. Why can't we? Why can't we go in our room?
Because you can't. She's got to come out and see us.
Daddy. Don't take me. Wait a minute. Don't take. Don't take. Her mom is.
It's Mother's Day, 1993. And I think Becky just got the best Mother's Day present that she's ever had. Can you say hi?
That last voice that said, "Get away from me," was Katie telling her brothers to get away from me. That was an important moment for her. Before we leave that spring day, 1993, we're going to hear what it was like for Katie, how she has come to grips with what she experienced that day, and how her perspective has changed or remained the same in the 16 years that have elapsed. Katie?
For me, 1992 is a year that will always stand out from the rest. It's not a year that I remember with particularly vivid detail. In fact, there are only a handful of snapshot-like memories that remain with me today. But whether or not anyone knew it at the time, 1992 would become a year that would significantly shape my life to date. It would greatly influence how I would develop as an adolescent and later as an adult, as a daughter, a friend, a wife, and likely one day as a mother. My memories from that year are simple and generally uncomplicated, much as you would expect from a 9-year-old. There are the memories common to most kids that age: Mrs. Morrison's second-grade classroom and its meticulously groomed butterfly garden, my best friend Miriam Winston and our Barbie doll playdates after school, singing in the elementary school chorus at local venues around town. And then there are the memories that most children, if they're lucky, don't have. Learning of my mom's illness and wondering what made cancer different than the flu. Having a teacher ask what type of cancer my mom had, lying and saying that I didn't know because I was too embarrassed to say the word breast. Sneaking visits into the hospital's surgical wing after hours with my dad, who managed to make it all seem like an adventurous game of hide and seek. Adapting to having my dad braid my hair every morning before school. Learning which female teachers could redo it once I got there. Trying to understand why the drug that would make mommy feel better would also make her hair fall out. Later believing that rubbing her prickly bald head would somehow bring good luck. Sitting in the back of our tourist station wagon before school, saying goodbye to my mom before her 4-week bone marrow transplant. She was aptly wearing a newly purchased Nike Just Do It t-shirt. Perhaps more than anything, I remember Mother's Day 1993 and the moments you just saw in that video. I remember the hour-long drive down to Miami's Jackson Memorial Hospital, sitting on that picnic table and waiting for my mom to come outside. We hadn't seen her in 3 weeks, which was the longest that we'd ever gone mommy-less. I remember seeing her for the first time and instantaneously realizing from her frail appearance just how serious the situation really was. I remember crying, not wanting to, but not being able to hold it in anymore, and doing my best to hide from the camera because it was the first time during that whole experience that I had felt weak. Weakness, an emotion that's strange, I realized, for a 9-year-old to feel. But in the months preceding the bone marrow transplant, my coping mechanism had been to take control of every situation that I could, and I tried to become the strong one. If I was tough and everything was in order, then surely nothing bad could happen. As my parents say, I managed my 2 younger brothers. Friends and relatives were streaming in and out of our house, and I did my best to keep a precise household routine no matter what. When my mom was an inpatient, I talked to her nightly and reminded her about how this was hard but so important so that she could feel better. My coping mechanism was strength, real or contrived. And in that video-captured moment, I remember feeling nothing but hopelessly weak. These are the memories from when I was 9. As a 9-year-old, I was in a strange place, trapped somewhere between innocent ignorance and fully aware comprehension. Unlike my younger brothers, I understood to a degree what was going on, but I was unable to process these events as an adolescent would. I had no way of understanding what had caused my mom to become so sick. I didn't reason through it in any meaningful way, but I simply assumed this was normal and what all families had to deal with. Since it had happened to my mom, it would inevitably happen to me. I just always accepted that someday breast cancer would also be my burden to bear. That feeling remained with me into my adolescence. When I was 18, my parents approached me about having BRCA1 testing done, and I couldn't see any reason to say no. Its results would either confirm what I had always thought, or would essentially set me free of the looming diagnosis I had always believed was ahead. In 2002, my parents and I went up to the University of Pennsylvania to receive my test results. We sat down with a genetic counselor in a small room full of double helix posters and miscellaneous scientific diagrams, none of which I understood. Not 1 minute into our conversation, the counselor announced very matter-of-factly, "Your test was positive, you have the BRCA1 mutation." Children carry experiences with them in ways that adults, their parents, friends, doctors, could never grasp. For that reason, genetic test results cannot and will not ever be received in two identical ways by two people, no matter how similar their background. In my family, we had all lived through my mother's illness together, but we had experienced it in starkly different ways. And our reactions to hearing those words, "Your test was positive," brought just such a point to life. My parents were devastated by the results. My theoretical odds of being BRCA1 positive were 50%. They had held out hope for the glass half full scenario. And because of this hope, I believe my BRCA1 diagnosis carried much heavier, much more terrifying repercussions and associations for them. The results brought back terrible memories of my mom's illness, and for them, the results were a sudden and harsh reality to bear. For me, the test results were by no means a death sentence, and they were not particularly jarring. They simply confirmed the deep intrinsic belief that I had adopted as a child, that left untreated, I was bound for the same experiences my mom had had. BRCA1 did not suddenly materialize that day at Penn. My chances of having BRCA1 didn't change with the giving or receiving of genetic mutation status. They were set from the moment of my conception. I was hard-coded with that gene mutation from day one. The bottom line is, information doesn't change the reality. And my reality was that BRCA1, with its jumble of associated diseases and odds, was something I would have to face and confront head-on as an adult. Today, knowing enables me to choose certain paths and take certain steps to ensure my future health. Options are available to me that weren't available to my mom because I know my genetic status. For instance, I have a thoracic MRI every 6 months and pay regular visits to a breast surgeon. And as Dr. Ross mentioned earlier, I am grateful to have a mom that calls me every 6 months to nag me to have my MRIs done. Because of my known genetic status, a prophylactic mastectomy is a very real and often recommended approach to preventive care. Without knowing of my genetic status, such a radical surgery would almost certainly have been seen as drastic and possibly unnecessary. It's very likely that one day we'll all have a customized list of our own unique mutations and predispositions to disease. I feel fortunate to have access to some of that information today. When it comes to genetics, ignorance is most certainly not bliss. Receiving my positive test results meant having scientific confirmation of my potential future health risks. That, in turn, means I am empowered about my own health through medical knowledge and information.
And thank you, Dr. Ross, for making it okay for me to nag her. So we wanted to loop back our comments this morning and turn everything that you've just heard into an ethical discussion, since that's the goal of the conference. And that said, some of the questions that you have asked of yourselves are the same ones that my husband Sam and I asked ourselves as we were trying to make the decision about whether to get Katie tested or not. One thing I didn't hear earlier as a factor for moving toward finding the mutation status was, and maybe I missed this from yesterday, but there were potential exposures that I was concerned about in the case of BRCA1. So Katie was 18, she was about to go off to Duke for 4 years. I was concerned that during that 4-year period she might decide to get on the birth control pill. And it is still poorly articulated whether the birth control pill taking confers a higher risk. We know it reduces the risk of ovarian cancer, but really my big concern was whether it accelerated the other risk. So that was a factor for me. That was a piece of information that I did not fully understand, and I also wanted to guard against her unintentionally harming herself. I did, by the way, tell her that at the time. I did also ask her permission to bring it up today, and she gave it. She was legally of age. She was 18. She was extremely mature, valedictorian, 4.1 grade point. I mean, very driven, very much a manager. So she was already in control of her health on many levels, but Sam and I were still very much in parent role with her, helping to inform her. Katie has told you about how it was for her. This morning, Sam and I discussed how it was for him, and he recalled his first word was dread. He was dreading it, dreading finding out the results. But he also, like I, agreed that it was better to have the information than not. And I felt something that there's no word for, but if you could take off the connotation from the word desperate that means urgent, and then splice that with the word invested, that's how I felt. I felt urgently invested in this information. Was it in Katie's best interests at that time to be tested? I think the key there is at that time. And I don't know whether any of you are familiar with Jackie Leach Scully's work, but she is a European ethicist who writes quite prolifically about relationship in ethics, and time being an element of some control. The timing may not have been quite right, and the concern for me there is that maybe we were giving her a message about herself that could coalesce into something like genetic determinism. Like, we really didn't want to do that, but in the end, the problem is a lot more. It's a lot more complicated than that. Physically, we needed to answer questions whether there were exposures to avoid. You hear about fat diets and in your diet and all these other things, but the big thing for me was the birth control matter. And the question, are there interventions? Is there anything to do with this information? In our case, as a result of BRCA1's being one of the granddaddies of mutations, there's quite a lot of medical infrastructure around it. It's not great, but it's better than most. We have prophylactic surgery, we have MRI, we have several other interventions that can be pursued. Psychologically, the privacy and confidentiality issue we had given up long since in our quest to pass genetic information non-discrimination legislation, which we've been working on since 2002. So everyone knew about us, and we almost had an attitude of kind of bring it on. We'd really like you to make this an issue for us. And no one did, but anyway, we were happy when the legislation was ultimately passed in April. And that's an understatement, right? But ontologically speaking, what does this information tell you about you? what does this information, what did it tell us about ourselves? And I'm not sure that anyone is ever sufficiently prepared for clinically significant genetic information. First of all, it's not known what that definition actually encompasses. But that information exists in a narrow band that rims our overall understanding of the disease process. And because that band is always changing to accommodate new information or to cast off inaccuracies, and we live there, we live in that band. The question for ethicists is going to have to be, who's there with us? Are we alone? Or are we with someone? And my theory is that you are here with us in that space. It is a place in which we have no choice but to proceed forward with the information that we have and to pursue information that we don't have but we do know exists. After all, we're not the ones that threw down the gauntlet of that law of battery. We are in complete self-defense mode. It is a place about which the pediatric oncologist Ray Barfield observed, and I thought this was so apt. Science cannot tell us what we ought to do with the knowledge generated by science. It's not up to science to tell us that. That answer has to come from our experiences, our hopes, our fears, and our being here in this nexus where data meets life. The answers are in relationship, and you need look no further. I tried to think of a way to finish my comments today that was going to be kind of clever, but I'm not feeling very clever. I'm actually feeling quite overwhelmed. And little did I know that I would find the answer to wrapping this up on a Starbucks coffee cup. And I even made Sam go back to the hotel and get it because I forgot it. It's the way I see it, number 293. The way I see it isn't necessarily the way you see it, or the way it is, or ought to be. What's more important is that we're all looking for it and a way to see it. And I thank you so much for listening.